provider secure? What duty of care do they have? They, for example, wanted to build apps where you could take MRI data and take them to India to have them interpreted, where it's much cheaper and you can get it done faster. But what duty of care does someone in India have to your data? Does it belong to OHIP, that data? Or does it belong to you? So anyway, lots of interesting questions come up right away. But the technology is getting developed so fast that people want this kind of information sharing. And so we're going to have to come up with really good policies around this. And technology is going to have to evolve. Actually, the technology is not there right now to understand how we do all these things.
There's another question back here. Go ahead, please. Sorry, you.
Yeah, so it's a question about sort of the interface of science and big data. So I've been doing a lot of reading recently about data science and big data, and my understanding, I mean, what I've come to understand is that they're not exactly the same thing. They're very linked, they're not the same. So I'm understanding data science as the science of doing science. In other words, how do we know that when we do science we're getting correct results? Big data is the unstructured, high velocity, veracity issues. The reason they're linked is because there's big data, it's calling into question a lot of the work that we're doing in science. So being a statistician as well, I'm watching my field sort of be skeptical, as we should be, but looking forward 5 years, 10 years, how does statistics actually take on some of this new work that's being done in like genomics, machine learning, where people are coming to all kinds of conclusions? There's going to be more false positives. How do we take that on as statisticians to ensure that we have scientific results that are actually more valid or are valid?
Well, that's a hard one as well, of course, and a great question. And I should mention that it's Teresa's slide that I stole the blue picture from, her ISIS. She's the ISIS guru in the room. So I can punt and say it's going to come from the next generation. We need to train statistical students the way Arvin's training his computer science students to talk to scientists and computer scientists. And we need to train people dredging through the big data in the statistical skepticism that we have. We can't be overly skeptical, but we have to be cautious. There's right now a lack of what I would call inference in the big data world. It's just look through, find something, got it, move on. And of course, inference is rather hard because you've done so many look-throughs and think you've found something, and especially medical people, never want to miss anything. So in some sense, they're more worried about false negatives because it's expensive to collect data still, and they don't want to miss something that might really be important. So it's going to come through training, and it's going to come through interdisciplinary training, I think. That's the only route I see forward.
Another question here. Sorry, I'm going to take the gentleman. I'm going to have to ask you to think about your questions over lunch, and then maybe we'll reflect in the panel after that. No, go, please ahead. Please go ahead.
So sort of question for the panel and comment as well. So I'm a health services researcher and a physician, and when I see patients, the traditional model is one where you look at the patient, at their risk factors, they're diabetic, have high blood pressure, they smoke, and so on, and you assess their risk for a variety of outcomes. And if you're the most sort of evidence-based and advanced clinician, you will know all the latest clinical trials in New England and so on, and know which medication is the proper one for that particular patient, which at the end of the day is all about probabilistic approach, where the average, you target the average effect of that drug in the average patient who looks kind of like your patient. And now we have precision medicine or personalized medicine, which is supposed to be revolutionizing this, where we're going to take the patient's genome and determine the very specific treatment that's right just for that patient. But I think the reality is we know that the promise of personalized medicine is, there's been few actual examples where it really has delivered yet. And what I'm finding interesting is when I listen to Stephen's talks, two guys not here, but ask the rest of the panel to reflect on this. As he described autism and what they're discovering around genes, it became clearer and clearer that there isn't a one-to-one relationship, that in fact specific genes will produce different levels of autism, or in some cases no autism, in different individuals, and even use the example of the father who didn't have autism when the son did the exact same genome, and whether the environment had some impact on that. So I kind of wonder, we're not just coming back full circle, where the various genes are just another type of risk factor, and we're coming up, we'll be looking at average effects of these genes. And is this truly a revolution, or is this just another set of risk factors like the ones we've been dealing with for 100 years?
And Michael is going to come back in the afternoon to chair the panel, so if we don't answer it, he can.
I'm personally always skeptical of people saying something is a revolution. I guess I'm getting to the age where I've heard the word revolution so many times that I don't think anything's really revolution, it's all evolution. But I think you're absolutely right that there's a little bit too much stock in genomic information giving us all the markers we need to figure something out. So that's why I talked a little bit about environmental information, that we still don't have good mechanisms of dovetailing the genomic and proteomics and the organism and then into the environmental. And I would imagine statisticians have to think a lot harder about that, because otherwise I think we could actually go down this wrong road of just assuming that we'll find these markers and we'll know everything about the individual.
So I'm going to bring the session to a close. So first of all, I'm going to actually ask Katie and Lynn to come up and just talk about logistics. But I'm going to put on my Massey College Senior Fellow role now, and the time-honored tradition is to give our speakers a yellow Massey College umbrella. Albie has provided these from the stock room. There you go. Thank you very much.
Thank you very much.
So thank you so much for all the questions and to our wonderful speakers. So we'll break for lunch right now. We'll have a light lunch in the junior common room, and we'll reconvene at 12:40. 12:45.
No, one.
12:40, yes. 12:40.
Very good.
Yep.